An HIV-positive diagnosis is not the death sentence it once was. For the majority of HIV-positive patients, it's a matter of taking one tablet of antiretroviral therapy every day to live a long, normal, and healthy life. In fact, that one tablet of antiretroviral therapy means that patients can achieve what we call viral suppression, which means that the virus is undetectable in their system and cannot be transmitted to others. So I'm explaining this to someone recently, and he asks the very relevant question. If taking an antiretroviral on a daily basis could save your life and protect others, why wouldn't you take it? So we're going to do a little bit of an experiment. I hope you'll indulge me. If you ever had to take medication on a daily basis, please raise your hand. Now it could be an antibiotic, it could be a statin, it could be a anti-anxiety, it could be a vitamin, it could be anything. If you've had to take medication on a daily basis, please raise your hand. Now keep your hand up. If you have ever forgotten to take your medicine, please put your hand down. Yeah, that's what I thought. The bottom line is that it is hard to remember to take your medicine every day, especially when a condition is chronic and requires lifelong treatment. The reality is that we have great medication to treat HIV and a whole host of communicable and non-communicable diseases. But the medications only work if patients take them. Poor treatment adherence results in reduced therapeutic outcomes, disease progression, but it also costs health systems billions. To give you an idea, the average cost of wasted medication to the NHS on an annual basis is about £300 million. This doesn't include unnecessary hospitalizations, unnecessary tests, preventable doctor's visits. Another consequence of poor adherence is that, as we know from our careers as amateur epidemiologists over the past few months, mutation of viruses and bacteria. And when a virus or bacteria mutates, we land up with things like multi-drug resistant tuberculosis, or antimicrobial resistant superbugs, or even drug-resistant HIV. The spread of all of these things is catastrophic. Poor treatment adherence is in fact so important that the World Health Organization have said that increasing the effectiveness of adherence interventions can have a far greater impact on the improvement of the health of the population than any specific improvement in medical treatments. So for the past 2 years, I have dedicated pretty much all of my research to looking at and studying and developing innovative solutions to increase adherence. But I'm not a doctor, I'm not an epidemiologist, I'm not a virologist, I'm not even a public health specialist. I'm a human-centered designer. And this means that I use a combination of behavioral economics, cognitive psychology, and design theory to help people change their behavior, build habits, and make better choices. I design for people, not for designers. I design sustainable and accessible solutions to real-world problems, and my area of expertise is healthcare and design that makes a difference. Now, treatment adherence, or rather poor treatment adherence, is a global problem. But many of the innovative solutions that are designed to mitigate for it are designed for the developed world, by the developed world. And in the developed world, the majority of solutions that we consider to be innovative are high-tech, they are shiny, and they are expensive. So a great example of this is a product called a Vitality Glow Cap. And it's basically a lid that fits onto the top of a pill bottle that helps patients remember to take their medication. If they miss a dose, it either lights up or it makes a noise. It can even be automated to send you a text or call you and remind you to take your medicine. Another awesome intervention is PillPack by Amazon Pharmacy. And what it does is essentially takes a high-tech robot that consolidates a month's worth of medication, even if you take lots of different meds, and it puts them into daily packaging with the date and time that the patient needs to take their medication. And this helps patients track and adhere to their treatment regime. And these solutions are awesome, but the biggest problem is that they are expensive and that 70% of the global population live in developing countries with varying access to these types of innovations. Innovation does not need to be shiny and high-tech. In fact, sometimes the cheapest, simplest, and low-tech solutions have the potential to make the biggest difference. In 1962, David and Doris Wagner have their fourth child. And like many other emancipated women at the time, Doris then goes on the pill. And as our little experiment just showed, it is hard to remember to take your medicine. Now, David and Doris did not want any more children. And so David designed the first low-fidelity pill box to help Doris track her medication. And this then formed the basis of the Monday to Sunday Dosset boxes that we all know too well. The problem with the original design and the Dosset boxes that followed is that they require patients or carers to decant medication every month or every week. And this is an onerous task, and many patients give up. But Wagner's design was innovative enough because it paved the way for the blister packaging that uses daily tracking, which helps millions of women adhere to their oral contraceptive. So in 2019, I was sent the brief to come up with a design-orientated solution to one of the United Nations Sustainable Development Goals. I was born in South Africa, as you can hear, and I was born and raised in the 90s during the peak of the HIV epidemic. And so naturally, I gravitated towards goal number 3, good health and well-being. The target that I focused on was to end the HIV epidemic by 2030. Now, South Africa has made strides in treatment policy and research, but we still have the heaviest HIV burden in the world. To give you an idea, 37.9 million people are currently living with HIV. 70% of them live in developing countries in sub-Saharan Africa, and 20% live in South Africa. Where I come from, lateral thinking and finding novel solutions to very big problems is not called innovation, it's called making a plan. It's often very low-tech and cheap and accessible, and people do it every day without million-pound budgets and the help of multinational consulting firms. And so the question for me became, is it possible to design an adherence intervention that could help make the lives of HIV-positive patients easier by helping them remember to take their medication? So I looked back to the interventions that I've spoken about. I looked at GlowCaps and PillPack, and the reality is that while they're great, they're just too expensive to implement, even at scale in the developing world. I then looked to Wagner's original design and the Dosset boxes that followed, and again the problem is that increased amount of effort that's required to use them. And then I looked to the blister packaging, and I said, well, this is also great, why isn't it used? Too expensive. But what do all of these things have in common? Daily tracking. So then the question becomes, can we use the daily tracking system that we know works and apply it to increasing treatment adherence in the developing world? So when you design for the developing world, there are 3 very important things you need to think about. Firstly, cost. Secondly, varying levels of literacy. And thirdly, access. And based on these 3 factors, I developed a set of constraints for myself. So firstly, whatever I designed needed to be cheap. It needed to be able to be implemented at scale in the developing world. It couldn't be digital, because not everyone in the developing world has a smartphone, and even if they did, your phone's not always with you when you take your medicine. My solution needed to be simple. In fact, it had to be so simple that patients needed to be able to use it without even being taught. And finally, it had to be accessible to individuals with very low levels of literacy. So I started with the design of the oral contraceptive packaging. But what I then did was I removed the expensive blister packaging. So I was left with this calendar system. From behavioral economics, we know that positive reinforcement is much more successful than criticism or punishment in changing people's behavior. I wanted patients to feel a sense of achievement and accomplishments when they'd taken their medication. And so I added in a tick, which is a universal symbol for achieving a goal. I used the color green, which is associated with positive reinforcement. So now we've got a calendar system that allows the patients to track their medication and keep track of their adherence routine. But how does the patient mark off the days? So when you're designing something novel, something that people haven't used before, it often helps to root it in something that they already understand. So now I'm going to show my age, but there is a reason that when they designed the save icon, it looked like a stiffy disk. So I did a bunch of research and I found what is something that is universally prolific. And I found that that was scratch cards. They are prolific in the developed and developing world. Everyone's seen them. And they have the sense of gamification and playfulness to them. Another key factor in behavioral design is to remove any barrier to entry, to make it incredibly easy for the user to be able to engage with the product. And so, by using a scratch card as a methodology, the patient A doesn't need any auxiliary tools. The barrier to entry is gone. They can mark off the day just with their fingernail. They also are using a system that they already know and understand. I also added in a little adhesive backing, so it was a sticker, so you could stick the calendar to the medication, and it would always be with it. It would never get lost. The theory says that to create a habit, you need a cue, an action, and a reward. So now the patient can see their medication, the cue, take their pills, and scratch off the metallic coating, the action, and then they reveal a tick, which provides positive reinforcement. They can also see at a glance whether or not they've taken their medication on any given day. Now, ironically, something that was originally designed for the developing world was first purchased for the North American and European market, which shows us that when you design for the developing world, with the constraints of the developing world, you can actually build something that is globally applicable. So now something that was originally designed to increase treatment adherence to antiretrovirals can also be used to increase treatment adherence to medications that are used to treat heart disease, mental health, diabetes, and many more chronic conditions. My design is just one example of a frugal innovation that can be used to change behavior and better the lives of people. But the message I want to leave with you today is that sometimes the best innovations are simple, not sexy. They are cheap and accessible, and they are low-tech and scalable. And these are the interventions that really have the potential to reshape reality. Thank you.